السلام عليكم جميعا. أنا آسفة جدا إنه ما قدرت أكون معاكم اليوم بهاي الورشة المهمة، بس للأسف مضطرة إنه أسافر. بحب أرحب فيكم ببلدنا الأردن الحبيب، وخصوصا كل أخواننا وأخواتنا من الوطن العربي. وآسفة جدا إنه أجيتوا بهيك أجواء الطقس مش حلو أبدا، لازم تعيدوها وتيجوا بالربيع إن شاء الله. بحب أستأذن منكم إنه أقدر أكمل خطابي باللغة الإنجليزية عشان أقدر أرحب بضيوفنا الأجانب. I would like to welcome you all to our beloved country, Jordan. So sorry to not have been able to attend this extremely important workshop, especially that I will miss seeing colleagues and friends from NCDs Child, American Academy of Pediatrics, International Association for Adolescent Health, and International Pediatric Association, as well as colleagues from friends from our Emro region. As a global advocate for NCDs and especially cancer, we all know that NCDs are the #1 killers of our time. 41 million people are suffering with NCDs, translated into 40 million man, woman, child, adolescent are afflicted with cancer, diabetes, heart disease, respiratory illnesses, and some form of mental illness, with 15 million people dying prematurely from these diseases. And if we want to resensitize the word prematurely so we can experience the commensurate moral outrage of these statistics that some of us have unfortunately become numb to, then this means 15 million people from our friends, aunts, uncles, mothers, and fathers are dying between the ages of 30 to 70 years old. So many will not have experienced marriage, career, motherhood, fatherhood, let alone being grandparents. All those key stages in the precious journey of life. Then break those statistics further. 86% of those patients are living in developing countries, our countries, most of which are least prepared to deal with those diseases. And 70% of those dying are young, given the young demographic profile that is prevalent in our region. What makes it more of an outrage is that 80% of NCDs, certainly heart disease, diabetes, type 2, respiratory illnesses, and iron deficiency, for God's sake, are so preventable, and yet many governments are turning a blind eye to dealing with the source of these deadly diseases that are so preventable. This, I find, is very irresponsible and certainly very frustrating. And this, despite the fact that since 2011, we in civil society and the World Health Organization have done everything in our power to support countries in their fight against NCDs. We advocated hard for the framework to have global targets with the overarching goal to reduce mortality, premature mortality that is, 25% by 2025. Then we have properly argued that NCDs are a development issue and not simply a health issue, making the political and economic case for them to enter the elite club of the Sustainable Development Goals. Together, we reframed our call to action in dollar terms to ensure that finance ministers understand that investing in NCD prevention, treatment, and cure is not only a sound economic decision but also a high-yielding investment. To that end, we have shown that investing $1.27 now on NCD prevention per person per year will yield a return of $7 in 2030, totaling $350 billion in 2030, $300 billion saved. So we deleted the box of we don't know what to do, we erased the no money argument, and we nullified the notion of the impossible, the challenging, and the complex. And yet, 15 million people are still dying prematurely every year right before our very eyes. WHO study for leading risk factors factors for premature deaths in our region lists the following: high blood pressure, tobacco use. Of course, it's alarming tobacco use. We all know that 30% of our youth smoke between the ages of 13 to 15. High blood glucose, physical inactivity, overweight and obesity, high cholesterol, and including again iron deficiency. And again, we now have yet another solution and the framework by WHO EMRO, who are presenting a comprehensive strategy for protecting adolescents. This includes a specific framework for NCD surveillance and monitoring among adolescents and young adults. As we know that this is the target audience that are most vulnerable to developing bad habits that unfortunately stay for a lifetime. But let us be clear that lifestyle changes, as they are so called, give the impression that it is a matter of choice or preference. But when unhealthy foods are more affordable than the healthy, when tobacco that kills is so easily available and cheap, and when facilities or space for exercise are non-existent, it becomes not a lifestyle choice but a life sentence. I believe that this workshop is very important. Why? Because I see from the list of participants here, government, civil society, health experts from all over the region are all represented here today. This is so crucial as this fight requires all of us to work together in a collaborative way. I sincerely hope that in the next 2 days, you transform that framework into an implementable, workable plan with dates, deadlines, actions, KPIs and tasks. We as a region really need to wake up and smell the coffee. The writing is on the wall. We are moving totally into a sick and injurious future. We need to ask ourselves, what legacy do we want our generation to be known for? The one that watched the NCD epidemic destroy the lives of our children and our children's children? Or the generation that said enough is enough and took action? The weight of this seminal decision is on all our shoulders. All of us, governments, health advocates, civil society, and others. I wish you all a successful 2 days. I look forward to receiving the results and recommendations from this workshop so we can all work together to help implement those recommendations. Thank you for allowing me the chance to give you this talk. God bless you all, and thank you for all that you do. Thank you very much.